From incarceration to inequity, connecting criminal justice reform and minority healthcare disparities. Growing up as a minority in North America, I've watched how systemic barriers in both the criminal justice system and healthcare disproportionately affect communities of color. I remember a Black classmate receiving a harsher sentence than his white co-defendant for the same nonviolent charge. And around that time, his mother could not access proper health care due to lack of insurance. These aren't isolated experiences. They're symptoms of systemic racism. We'll explore the connection between mass incarceration and health inequities, focusing on the Ban the Box initiative and broader systemic reforms needed in both sectors. Black and Latino communities face longer sentences and are incarcerated at disproportionate rates. The NAACP reports that Black Americans are 5 times more likely to be imprisoned. On the health side, Black mothers are 3 times more likely to die from childbirth-related issues, and communities of color suffer the worst during the COVID-19 pandemic. These outcomes are the legacy of policies like the war on drugs in the 80s and racial segregation in healthcare. The root causes are structural, and the solutions must be too. So, brief history lesson. In the 1980s, the U.S. government intensified its war on drugs, launching aggressive policing and mandatory minimum sentencing laws, particularly for crack cocaine, more commonly found in Black communities, while treating powder cocaine, which was prevalent in white communities, with more leniency. This disparity led to mass incarceration, with Black Americans being arrested and imprisoned at far higher rates than their white counterparts for similar offenses. The policy's legacy contributed to systematic racial inequities in the criminal justice system that persists today. The Ban the Box initiative aimed to level the playing field by removing criminal history questions from job applications. While it reduces initial bias, research shows that many employers still discriminate during interviews, especially against Black applicants. The progress and limitations. As a recent report states, 37 states, the District of Columbia, and numerous localities have implemented the Ban the Box policies to promote fair hiring practices. But despite these policies, individuals with criminal records continue to face employment discrimination, highlighting the need for comprehensive reforms beyond initial application processes. What I would recommend for this policy would be to enhance employment opportunities by implementing mandatory anti-discrimination training for employers, providing tax incentives to companies that hire formerly incarcerated individuals, as well as developing job retention programs and supportive networks to aid with reintegration. What I would recommend on the healthcare side is to improve healthcare access by mandating Medicaid expansion across all states to ensure coverage for low-income populations. In addition, convert executive orders into legislation to maintain healthcare reforms across administrations. And lastly, I would increase federal funding for mental health and healthcare services within correctional facilities. What I believe will change with these reforms is it will bring real hope to people. Families will access life-saving care and will finally have it for everyone in the country. Formerly incarcerated people will be able to rebuild their lives, and communities will see less poverty and more inequity. Enhancing access to healthcare and employment opportunities can lead to reduced reoffenses, improve public health, and strengthen trust in the public's institutions. As you know, many people of color do not have much trust in the institutions of our government. So addressing the intertwined issues of criminal justice and healthcare disparities require systematic change. By implementing comprehensive reforms, we can move towards a more inequitable society where all individuals have opportunity to thrive. This isn't just about numbers or policies, it's about real people, real lives, real pain, but also real opportunity. As future social workers, advocates, and policymakers, we have a duty to push for solutions grounded in inequity. Let's ensure that policies that we support aren't just performative, but they're transformative, because systematic change starts with us. I hope you enjoyed that content on today's subject, which was from incarceration to inequity.